I also feel the same. Every time when there is something that happens to a family member, I always feel that there is this like, oh, you should go to the hospital and just be there. But then I feel like when I'm there, right, does it really help?
Yeah.
I mean, I can have a conversation with you for like 15 minutes, lah, right? And I can be there, I can sleep overnight or whatever. For sure, I can. It's just that I don't know whether I'm another obstacle for the care, like the nurses and the, you know what I mean? It's like they have to give additional information to me, and then like I need to walk out of the room, and then it's just additional for them, and it's just gonna like make it worse for them to deal with it, right?
Yeah.
And I don't even know how to deal with bad news, especially when it's on the spot.
Yeah.
I don't know, man.
What I always have taught my nurses is that if we are with, we always identify a caregiver, that one person that you know can be the source of information. Yeah. So whenever family members come and say, "Hey, why? What happened?" Because they will come.
It's non-stop. You repeat and repeat, and you're like, dude.
So imagine an ICU nurse. We work for the morning shift 7 to 2 or 2 to 9, 2 p.m. to 9 p.m. or 9 p.m. to 7 a.m. Yeah. So those are the three usual time hours. So we do 12-hour shift, 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. We can do that kind of shift also. And imagine as we are doing nursing care, then one family member will come and say, "Hey, so what happened to him?" And as data protection, we can't be disclosing everything, you see. So we always say, okay, could you see family member A? They will let you know. So when it's always important that also if
it's privacy of the patient's confidentiality.
Yes, and if you do have if you do come into this kind of scenario, identify a family member. If the person is in ICU, identify, okay, my brother will be handling everything. So anything, speak to my brother. Because the last thing you want to do is, if people are caring, they are not wrong in coming and asking because they find that's their sense of purpose. If you don't go and visit, also wrong. Then they say, why you didn't come and visit me? Things like that.
That one another family feud.
Bloody Asian shit. This is such Asian shit, I swear to God.
But what I'm trying to say is, that nurse has duties that she has to do. So coming back to that question,
and other patients, right? So,
so if you're doing like an ICU, you're doing one-to-one care, you're basically carrying out all the doctor's orders. We are also assessing whether whatever treatment that's being rendered is effective. So whatever medication you order, antibiotics you've ordered, a wound, is it healing? If the patient needs a tube through the nose into the tummy, the nasogastric tube.
Actually, low-key like CSI. It's on the spot CSI, if you think about it.
You've got to like
attentive lah.
Because as an ICU nurse, an emergency nurse, you've got to really read the signs. You have to know your patient, because when you miss anything important, that's when the patient turns bad. So this comes through a lot of experience, when you do that. But it's always important to have that one family member. And then everybody can always go to that family member.
Instead of
so otherwise you have 20 people. I had one patient in ICU. This was a post bypass. He's quite ill, and then one of the relatives came. He said, "I'm a doctor." I said, "Oh, okay. What's your specialty?" "Oh, I'm an ophthalmologist."
Okay,
so
cool.
I said, "Okay, yeah. Okay. So how's the patient?" So I went, "Okay, doctor. Okay." So I rattled up. I told him all, because you're an ophthalmologist. This is a cardiac case, you see. You would understand, but certain things you might not be,
It's not detailed. I mean, technically
it's not your specialty, right? But when we have medical students coming, that's another story. Because sometimes the relative is a medical student. Oh, I'm a doctor. So, sorry. I'm finishing my medicine. Oh, you're medical student. Yeah, I'm 5th year medical student. Okay. So what's wrong with my son? So I'll explain. And then you'll be like, So, you mean well. Because that's your sense of concern, that's your sense of purpose, totally understand. But also try and, when you identify one person, everyone can go to that source of information. Then you don't ask the nurse.
It's also responsibility, right? Because
persistently.
And like the information.
Don't disturb them.
And the information also you waste your time, number one. And number two also, you're not so sure, right? If let's say I told everybody that you should go to Andrew for the information, right? But if the nurse were to brief one by one I wouldn't, maybe I'm not comfortable saying to everybody that I have this certain thing with my body or whatever, right? So Andrew would be the filter because I'm already like, right, like I'm like KO.
You're in a hospital to heal.
Yeah, that's your purpose, right? It's just to recover, ma.
But everyone will come and ask you, so how are you today? What did the doctor say?
Say I need a hair dryer.
Anyone came?